Hi, this is Maria, Future Psych NP. Today, we're going to be discussing about a case that I had, one of my patients that I had this week. Today is the Unit 5. I'm a little late, but I'm trying to catch up. So, this week, I encountered a patient diagnosed with schizoaffective disorder, which is pretty new to me because it's a pretty new diagnosis. So the patient presented with both mood instability, which is really common in the psych substance abuse world, primarily depressive episodes, and then symptoms of psychosis such as auditory hallucinations. Managing both mood and psychotic symptoms together was challenging, but it was an eye-opening. The impact of my understanding was that this interaction helped me understand the complexity of diagnosis that overlap mood and psychotic disorders. It also helped me reinforce the importance of differential diagnosis to ensure appropriate treatments for psychoaffective disorder. As a future psych NP in the next couple of months, I need to carefully assess not only the symptoms that the patient is currently experiencing, but also over the course of time. So over the course that they're with me under my care, to develop an effective treatment plan that is going to help them be safe and is going to help them treat their symptoms. So this strands, to be honest with you, I feel that effectively I built a good rapport with the patient. I usually do with most of my patients, empathetic, validating their experiences, and using active listening. All those three qualities are qualities that I have had throughout my nursing career. This reassured the patient, especially since they felt misunderstood by others. Limitations, I feel like I struggle with some clinical decision making, such as balancing mood stabilizers versus antipsychotics, picking the right medication for the patient, deciding what will work for them. I realized I need more practice in medication management and staying up to date with evidence guidelines. And I think as a psych NP, when I start practicing, I'm going to be doing that because I want to make sure to diagnose my patient correctly and give them the medication that is going to give them the best care possible. And I know that every patient is different, so I know there's a few options. One of the best apps that I like is Drug Guide. I have that app, and I have used it throughout my 10 years of nursing experience. But one of the other apps that I love is Up to Date, that keeps me up to date with diagnosis, medications. I consciously practice maintaining neutrality to avoid over-identify with patients' emotional struggles. However, I also use my personal one to create a safe environment. People tell me that I am very calm. So my demeanor is very calm and very and it helps patients open up to me, which helps me develop trust early on. Reflecting on this case, I learned the importance of being flexible in my therapeutic approach, adapting to the complexity of the patient's unique situation rather than fitting them into rigid diagnostic boxes. When I started working in the psych world, I started working here 10 years ago as a substance abuse nurse, as an LPN. I could tell you that I would never forget the words that the CEO told me. And it's like, for substance abuse, these patients are treated bad all their life. People call them addicts, people call them names, and they come here to get help. So it's our job to make them feel safe, to make them feel loved, and to make them feel like they could get help and they could change their lives for the better. And that stigma, all addicts are addicts, they relapse and they don't, But anyways, thank you for listening and see you next time.